You're listening to the station that serves your community. AM 1240 WGBB.com and 1240 WGBB Freeport.
This is Healthy Living Radio with your host, Dr. David Scharf, a compelling program featuring today's top healthcare professionals. Join us as we explore the latest treatments and technologies to provide better care in today's ever-changing world of health and wellness. Now here's your host, Dr. David Scharf.
You're listening to Healthy Living Radio, dedicated to bringing you the latest advances in health and wellness so you can live better, healthier, and longer. I'm your host, Dr. David Scharf. We have a great show planned for tonight, something a little different. We have a great guest, Dr. David Diamond, the premier dentist really in North Babylon and the whole Babylon area, was gracious enough to take some time out of his practice to talk to us tonight. So, Dr. Diamond, thanks for coming down.
Thank you very much for inviting me. It's a pleasure to be here.
So we're going to talk about new technology in the dental practice today. There's a lot of new technology. You said a lot of neat things that I think most patients don't even know exists.
That's right.
So maybe they don't even tell you about these problems because they don't know that there are easy solutions. But before we get into that, maybe just tell our listeners a little bit about where you grew up, where you went to school, that sort of thing.
Where I grew up. I grew up in Brooklyn, but that was a very long time ago. I went to dental school at the University of Pennsylvania School of Dental Medicine, graduated in 1985. I did a one-year dental residency. I worked for several dentists for a few years. I came out to the South Shore in 1988. I actually came out to join a TMJ practice for treatment of temporomandibular joint disorders. I was, related to my TMJ experience, I was the medical director at Southside Hospital in Bayshore of the TMJ clinic at the time. Also, back then, I was the division head of the TMJ service at Nassau County Medical Center, where I taught the dental residents diagnosis and treatment of TMJ. So I have many years of experience treating TMJ, and now it's a part of my practice. I don't limit my practice to that.
How long have you been in North Babylon?
North Babylon, it's just a little over 2 years now. Before that, I was in Bayshore from 97 till 2009, and before that, from 88 to 97, I was in West Islip.
So to the patients in North Babylon who are you're their new dentist, maybe you've really been on the South Shore for quite a long time.
Quite a long time, yes.
Couple of decades. How old were you when you knew you wanted to be a dentist?
I'm not sure if I still want to be a dentist. No, I'm kidding. Actually, it came after several other professions. I was Actually, I was in home improvements for a while. Then I was a shop teacher for a while.
Is that right?
Yes. And whatever I did had to do with being good with my hands. And it carried over, thank God, into dentistry.
Very interesting. Good thing you didn't cut off any fingers on the bandsaw. It would have been a distinct disadvantage.
They're all connected, all work.
So let's get into tonight's topic. I know you were telling me there are some neat technologies, but before we even talk about new technology in the dental office, maybe you could tell our listeners. I mean, I'm sure, where do most of your patients come from that come into your practice?
They come from some marketing that I do. They come from word of mouth. Patients who are satisfied with the treatment we provide and the service we provide in the office and are happy with the office in general, refer their friends, colleagues, family.
And do you typically see people who've been away from the dentist a long time, or most of them regular dental patients who just are changing dentists and want to upgrade to a practice like yours?
It varies. Many patients are upgrading. They've been taking care of their mouths. They might have a problem here or there. And then there are patients who haven't been to a dentist in, well, actually yesterday, somebody who hasn't been to a dentist in 30 years.
30 years.
And he doesn't hold the record, though.
Oh, yeah, what's the record?
The record is 50 years.
Wow. You have to wonder after 50 years why they finally decided to come in, but that's a topic for a whole other show.
A front tooth broke. That was the only problem.
So let's talk. I'm just, it always fascinates me, and I'm sure our listeners would want to hear, what is it that keeps people away from the dentist, do you think, for so many years that they just don't go? What's been your experience?
Well, from what I've seen over the years, one of the major obstacles is fear and embarrassment. Patients come in, they let their mouths go over the years, and then they just felt that they were too embarrassed to come in, sit down, open their mouths, and have somebody look. I had a woman tell me she was afraid she would be yelled at, which actually she was by another dentist. Mm-hmm. And I explained to my patients in those situations that there's no shame, there's no blame. I'm here to help them. achieve a healthy mouth and the mouth that they want and be able to smile. Try to give them a diamond smile.
I love that name, by the way, Diamond Smiles, for your practice. That is genius. Why do you think that a dentist would do that even? I mean, you know, you're sort of a healthcare provider. If you treated obese patients and that was your specialty in helping them lose weight, you would never yell at a patient for coming in and being obese, right? It's almost counterintuitive so. that a dentist would yell at a patient for coming in to get the help that their training centers around them giving. So
apparently some people are judgmental no matter what they're doing.
So how do you address that fear issue? There's probably people listening to the show right now who are thinking, boy, I haven't been to the dentist in 51 years. I could be his record. But I'm just terrified of going to the dentist. You know, my last recollection was it was very painful. But I know you were telling me before the show that it really doesn't have to be that way. There's a lot of stuff that you do to allay people's fears, and maybe just tell our listeners about that.
I think one of the sources of fear is unknown, fear of the unknown. Patients know that they need treatment. They don't know what treatment they need. They don't know how the treatment will be provided. They don't know how they're going to feel during the treatment. Many people are scared of needles, and yet they can do other things related to needles, like get a little tattoo, which is, I hear it's painful, and yet they can do that, but they're still afraid of a needle from a dentist. I think it might relate to a prior experience. Maybe a dentist wasn't as careful as he might have been, and that's what they focus on. That's what they're afraid of. So I try to, first of all, tell them that we will do everything that we can do to make them and keep them comfortable during the treatment and after the treatment. And also, I explain everything I'm going to do, and my staff knows. And we even had a comment on Facebook, I think, that a new patient said that constantly she was being asked, "Are you all right?" I think that helps a lot. It's a very simple thing to do. Doesn't cost anything. The patient feels much better knowing that there's somebody there who cares about how they feel during the treatment.
That they don't feel that loss of control. I think for a lot of people that's a big issue, that they'll lose control, it's going to hurt, and the person doing the hurting isn't going to care and stop.
I agree. And if I tell patients, the old standby was raise your hand if you feel something. I tell patients, if we're working in your mouth, we don't see your hand. Make a grunt, make a sign, do something. And the fact is that by the patient's body language, we know if they're feeling something. And I immediately stop and say, "Are you okay?" And they appreciate that. And most of the time they say they're okay, and I continue.
It was just a random grunt. Continue on, Dr.
Exactly.
Okay, so we went through fear and embarrassment. What are some of the other reasons you think people stay away?
Patients are concerned about time, about, first of all, how long it's going to take. Well,
everybody's so busy. You know, there's no one has any free time anymore, right? They're either the mom driving the carpool, or the dad maybe working 2 jobs, or working during the day and responsibilities
at night. And the kids in school, and the kids after. If you'd figure a kid is finished with school at 2, 3 o'clock, but that's not the case. The case is that at 3 o'clock they have lacrosse. At 5 o'clock they have karate. At some other time they have library. Everybody has a lot to do, and they kind of put the dental visit or the care or the maintenance, they set it aside. They say, "Oh, I'll get to it." But as we know, putting anything off, just the time interval grows and grows, and all of a sudden that 6-month cleaning is like 9 months or a year, and then whatever we do to try to get the patient in, life gets in the way. We know that. We're practical about that. So what we do is we accommodate patients' time. We have hours which make it easier for them to come in for their treatment. If they request doing a lot of treatment at once, so they only have to come 1 or 2 times, we can accommodate that as well.
Do you think that people truly don't have the time, or it's their perception? I mean, if you look at statistics of how much television people watch, or how much time people spend watching sports or playing sports or on the computer on Facebook, do you think that they really truly don't have the time to do it, or they just don't make the time because they maybe don't appreciate the importance of it?
Well, as I tell my patients, I'm a dentist, but I'm also a human being. And the fact is that I put things off that I don't want to do. So it may not always be that there is no time. It's more that, well, I'd rather go to bowling or go watch this TV show or go out to dinner than go to the dentist, which is totally understandable. Our responsibility to our patients is to make them understand the value and the the ultimate health benefits of making the time to come when they have to come to the dentist.
Mm-hmm. Interesting. It's interesting. What else? What other reasons do you think keep people away?
In this day and age, certainly cost is a factor.
Mm-hmm.
People, first of all, they don't know what treatment they need. When I tell them what treatment I recommend, then the next question is, how much does it cost?
Mm-hmm.
Cost isn't as much a barrier as most people think, for the following reason. First of all, many patients have dental insurance. We will help. We have experts in the office who will help the patient maximize their benefits. That's number one. If patients either don't have insurance or if their out-of-pocket is more than they can afford immediately, we help them to finance the treatment. We work with several finance companies dedicated to financing health care.
Mm-hmm.
And we do everything we can do to help them attain what they need to do.
So you think there are some people that don't even bother coming because they think there's no way that I can afford this?
Exactly. And the fact is, going back to being a person also, I've been guilty of that. Mm-hmm. I've put off things that I thought would be so expensive. Then when I finally look into it, I realize I shouldn't have put it off for 2 years.
Do you think that maybe people, feel that's expensive, but they just aren't appreciating the value of it? So, say someone who's works at a company, and when they smile, they're missing a tooth in the back, but everyone sees it when they're smiling. They can't quantify the fact that they're not getting their promotion, or maybe they're a less effective manager than they could be because everyone they manage is looking at the space in their mouth, and they don't see it. I think that's a hard thing for patients to quantify sometimes. And just take my own observation, I always think it's interesting that some patients will have a hard time carving out something in their monthly budget, maybe $200 to $300 a month of a monthly budget, and yet maybe they smoke a pack or a pack and a half a day, and then they have a cable package with HBO and a couple of movie packages. In between smoking and HBO, that alone, they're maybe spending $150, $200, $250 a month, really on nothing,
Right.
on nothing. And sometimes they don't appreciate that. Well, I could take those dollars, put it towards this, and really make a change in my life.
That's an interesting point. And the fact is that many dentists look at competition the wrong way. For example, on the street where I'm located, there are at least 2 or 3, maybe 4 dentists within a 1 mile distance that patients can go to whichever office they want. And some dentists say, well, there's so much competition there. The fact is that, as you said, the competition isn't from other dentists because there is enough of a population to support as many dentists as there are in the neighborhood. The competition, as you say, is from what people want to have each month, and they will pay for it. So when I tell a patient, well, you should get this done, and they tell me they don't have money for it, my failure has been not to explain why it's important for them to have this treatment done. So what we've done in the office, first of all, we take pictures of everybody with a wide smile.
Mm-hmm.
Most people don't, if they don't like their smile, they're not going to smile. They're not going to go home and look in the mirror and say, oh, I'm missing a tooth, or this tooth is crooked. So that's right off the bat. So they see their smile. That's number one. Number two, we have an intraoral camera, which is a small camera hooked up to the computer, designed to go into the patient's mouth. So if I see a patient who has a big hole in the tooth, but they don't feel it, I show it to them. And most patients are aghast to see. They say, this is my mouth, that's in there. Mm-hmm. So it's a lot of it is education and awareness. Mm-hmm. And once we've made the patient aware and showed them what the condition is, I'll even show the patient an x-ray. And I explain to them, I'm not trying to make you into a dentist or a radiologist. I just want you to see what I'm seeing, and then we can discuss what I recommend. Mm-hmm. And I think that goes a long way.
It sure does. It sure does. Because then they understand how it will benefit them as opposed to the other way around.
Exactly.
Do you find that, I've had some other guests tell me this, and I wonder if it's been your observation as well, that with the economy, coming out of the recession now, that a lot of people who are unemployed actually felt that having their teeth look presentable was more important than ever. Because, for every job interview they went on, there were 50 people competing. And all things being equal, what employer wouldn't want the person who has a smile that looks intact, and that looks nice? And I've heard multiple stories of dentists who treated unemployed patients who patients realized their teeth were holding them back, fixed their teeth, and then they could get employed or they got a promotion because that's what it was. And I'm wondering if you've seen that as well.
I can think of a patient currently who is going through that. She lost a job, and she was waiting for me to do what I had to do. And at this point, she's only wearing a temporary bridge, but it's in the front of her mouth. It's very aesthetic. Nobody can tell it's a temporary. Once she had that, she was able to go on interviews.
Amazing, right? And I bet you for a lot of those people, it's twofold. It's the fact that it looks better, but also the confidence is better. How can you go on an interview and not smile? The person interviewing you is going to think, well, they're a stick in the mud, they're a sourpuss, when in reality, they're just embarrassed about their teeth. But you only get one chance to make that impression.
Sure.
It's interesting. So let's talk about some of the other reasons why people don't go to the dentist.
One of them is lack of urgency. Again, going back to education, awareness, people just don't think there's any immediate need to take care of the treatment that they really should have taken care of.
Well, people are really focused on if it's not hurt, if it doesn't hurt, it must not be broke or something like that.
And as you know, and we have to teach patients when we take an X-ray and we see advanced periodontal disease, but they don't feel anything. We have to explain to them that it's a disease that doesn't hurt until it's too late.
So let's talk about a few of these things. So let me play devil's advocate. So I have some decay in a tooth. I have a cavity in a tooth, and you see it on the X-ray, but it doesn't hurt me at all, right? Why not just wait till it hurts me to get it filled? Why do I have to rush out when you tell me there's a cavity and get it filled?
That's a good question, and I use the phrase with patients that it's Murphy's Law. You have something that should be treated. It doesn't hurt now. It's going to hurt Christmas Eve at 2 a.m. in the morning when there's no one around. It's going to spoil your holiday. I've seen it before. I don't want you to be in that position.
Mm-hmm. But whether they treat it, now when it's just a cavity or the cavity gets deeper and deeper, does it become the same cost over time, more expensive over time, less expensive over time?
The cost for the longer you wait, the more treatment you need. The more treatment you need, the more it's going to cost. So that little cavity that I see, which is only a pinhole on the tooth, and I say, I recommend we fix that, do a little cavity. Patient goes away, you don't see them for 2 years. Now you take an X-ray, the cavity is touching the nerve. It still doesn't hurt, but it's touching the nerve. They still don't want to do anything about it. Next time you see them, the face is swollen because the nerve died slowly over time, so they didn't feel while it was dying. The infection grew in the bone, finally destroyed the bone, pus filled up the gums, and now they're totally swollen. Now the tooth can't be saved. Now they need the tooth extracted, but you also have to deal with an infection, and we know what infection. Basically, to keep it simple, an infection in the top teeth will go towards the brain, bottom teeth will go towards the heart. I like to keep things very simple for my patients.
Your approach is a little more unique than most. I mean, your patients are lucky that you really take the time to educate them and take the time, because I think a lot of dentists just say, hey, you have 3 fillings, make an appointment. They don't really take the time to explain that to people. And look, from a financial point of view, it's probably better for the dentist not to take the time because you end up doing more costly treatment down the road. But, I give you credit for really educating patients like that.
I think it comes from my experience as a teacher. I just like to teach people and then proceed.
Yeah, that's a good point. It's in your DNA. So let's go one more step. So let's say then someone needs a tooth taken out, and then they're faced with, well, should I replace the tooth, or I'll just leave that hole. It's in the back, nobody sees it, right? So what's the danger in that? Okay, so I didn't want to do the filling. I got another year or 2 out of the tooth. You pulled the tooth out. It's in the back. What's the big deal? Why should I bother to replace it?
That's a good question, and that's a question every dentist hears every day. Why should I replace a missing tooth? I remember years ago, an old dentist gave me this little mounted picture of why should you replace a tooth, and it has to be 50 years old. Some things don't change. When you lose a tooth, people don't realize a tooth is there for a purpose. It's not just sitting there as a static object in your mouth. The tooth is there to hold the other teeth in place in their proper position. It's also there to keep your facial structures, your cheeks and your face looking the way it should. If you lose a tooth, what happens is the teeth around it will all start to move. they start to move, that increases the chance of getting cavities in those teeth because now they're not in the right position. That's number one. Number two, it increases the chance of getting periodontal disease because now the teeth are moving, the gums are changing, the area under the gum is deeper than it was when the tooth was straight. So basically, I like to show patients pictures, both in their mouth and show them drawings, to show them why they should replace a tooth. Then, of course, they ask, well, how should I replace it? And I tell them that provided the area is healthy, an implant is the best way to replace a tooth. They say, well, it's so expensive. So I explain to them, here's the statistical progression of what happens if you put a bridge into a tooth, which is what most insurance companies will pay for. Within a certain amount of time, statistically, one or both of those teeth is going to need root canal because you cut the tooth structure away to make the bridge. Mm-hmm. That's number one. So eventually you might need root canal. Statistically, again, this was by an implantologist who teaches, who's written several books on implants, and he went to insurance companies to explain this to them. Over time, one of those teeth is going to be lost, and you have to make a longer bridge. Now you have a longer bridge, and in 10 years, something else will. It's a domino effect. Mm-hmm. If you put an implant in and put a crown on it, you haven't touched the teeth on either side of the space. You can still floss the area and keep it clean. And in my mind, and in this day and age, we're in 2012, I think it's the best, and I think the only proper way to replace a tooth.
How long, what's the average for how long a tooth-supported bridge would last?
That's a good question. So let's talk about, again, going back to insurance, and they all go by actuarial tables. It's always 5 to 7 years.
And how long, statistically, would a dental implant last?
As far as I know, they last forever.
Okay, so
once they're here, and patients ask me that, how long will it last? I said, if you're healthy and you heal properly, once the implant has healed to the bone, that's it. It's there.
And what's the relative cost differential? So if someone says the tooth is already out and they're deciding between I should do a 3-tooth bridge or I should put an implant in and make a single crown on it. You don't have to give me the exact number, but is the implant twice as expensive when they're done, 10% more expensive when they're done?
By the time they're done, it's the same.
It's the same. So
it's exactly the same, which is what I try to impress on them.
But you said before that the implant was more expensive. It sounds to me like the implant is really much less expensive. I mean,
ultimately,
if you could buy 2 cars, right, and one was going to last you 5 to 7 years, and the next car was maybe even a little more expensive, it was going to last you the rest of your life and still look good 30 years from now, isn't that the better value?
The term that comes to mind is a no-brainer.
So do patients not realize that the implant's the better value? And what's the roadblock that patients have?
Education.
Mm-hmm.
Understanding what it is. And again, I can show the patient, this is what it is. This is how it works. When it's in your mouth, ultimately, you chew, you talk, you keep your mouth clean, and it's just going to go on and last. That's all.
What do patients typically say after they've had an implant done in terms of were they glad they did the implant? Did they regret having done the implant? What are people's typical response?
I have no one who has ever regretted getting implants. None of my patients have regretted.
You know, you mentioned also, just as we were talking about replacing missing teeth and maybe taking people whose mouth has fallen into disrepair, and for whatever reason they finally get to it and fix it. Do you ever get people at the end of that regretted it, say, boy, I wish I had never done this? You know, or what's their reaction typically once they've taken their mouth from a state of disrepair to a place where they can be proud of it?
Patients are so grateful to be able to chew properly, to be able to talk without, let's say, take a typical denture patient. Many denture patients tell me that either they have to use a lot of denture adhesive to keep their teeth in. I've had patients tell me that they never go out to eat because they're embarrassed. So take a patient like that, even if they get 2 implants to hold the dentures in, and I tell them it's a great start. Mm-hmm. It's a new lease on life. That's what they tell me. It's totally, they have a life now. They cannot have to worry about being embarrassed in public.
When it's even without a denture patient, do people sometimes say, like, I didn't even realize that I couldn't chew well until you put me back, or I never realized how embarrassed I was by my smile, that I don't, everyone tells me I smile now. I thought I was smiling before, but I really wasn't. Do you ever hear those stories as well?
All the time. All the time.
Yeah. And do people regret not having done these things sooner?
Most of them. I have a patient who had one tooth left in her mouth, and she was just so upset that she let somebody take out all her teeth. Because even patients who have natural teeth, what I'll do is try to make it what's called an overdenture, which is a denture that'll clip on to whatever teeth they have left.
Mm-hmm.
And if a patient doesn't have the teeth, then obviously I can't do that. If they can't afford implants, well, we try to work something out so that they can get to that point.
Mm-hmm. So it doesn't always have to be your way or the highway. There's other ways, many ways to skin the cat.
We work with the patients. Sometimes a case may take more than a year, more than 2 years. We'll nurse them along. We'll keep them happy. We'll keep them healthy until they can get to the treatment they want.
What do you say to people who say, I'm too old for this? And I would guess you hear it in people in their 60s, their 70s. You probably hear it at all age spectrum.
40s, 50s, 60s.
So what do you say to those people who you talk about maybe replacing mason teeth and like, I'm too old already?
Okay, what I tell them is that I had a patient who was 95 who needed a new bridge. Not a denture, a fixed porcelain bridge. 95 years old, and she said she wanted a new bridge. Unless somebody is really, unfortunately, not going to make it, and I haven't had any patients like that, fortunately.
Who's the oldest patient you ever treated?
I think this woman who was 95.
Yeah, and she got her new bridge?
Got her bridge. She loved it.
Yeah. What was her smile like? Was she a vivacious 95-year-old, socializing, all that stuff?
Actually, it was when I had my office in Bayshore. She lived about 2 blocks away. Used to walk into the office. Interestingly, she moved, but she came by to say goodbye. That's how the kind of trust and relationship that we had with this patient.
Wow, that's nice. You know, we just have a few minutes left. Was there any other reasons you wanted to touch on in terms of why people don't go to the dentist more regularly or things that keep them away?
Well, as I just said, trust.
Mm-hmm.
When a new patient walks in, they don't know me, they don't know my office, they don't know anybody. They might have had bad experiences. They might have had experiences that kept them away from the dentist. So what we need to do is to develop the relationship using some of what we spoke about, understanding what they're thinking about going to the dentist, what their needs are, what their wants are. More than the needs, it's the wants. And it's our responsibility to develop the trust, to develop the relationship. Sometimes it takes a while.
Mm-hmm. Do you ever find people that are in your practice for a while and they kind of have to settle in before they're ready to do their dentistry?
Definitely. We've had patients who called up and they said they don't want to sit in the chair. They want the doctor to come out to the reception area, say hello, and that'll be the first visit. And that's fine.
You know, tonight was a great show. Unfortunately, we didn't get to talk about new technology at all, but I found this so fascinating that I didn't want to talk about that. Would you come on the show another night and talk about?
I'd love to. I'd appreciate it.
So many interesting things. You're an expert in TMJ, and we've never had a show on that. I'm sure our guests would love that. I know you're an expert on treating bad breath. We spoke a little about Invisalign, Snap-on Small, all kinds of new technology. So we'll have to have you back another day.
It'd be my pleasure. Thank you very much for inviting me.
You're welcome. In the last 30 seconds, maybe just tell our listeners exactly where you're located, if they want to call you, what your phone number is, your website, that sort of thing.
The practice is called Diamond Smiles, 789 Deer Park Avenue in North Babylon, just a little north of Sunrise Highway. The website is diamondsmilesny.com.
Excellent. I love that name, Diamond Smiles. That was genius. Did you think of that?
Not exactly, but
you took it as your own. Congratulations.
I took it. Thank you very much.
Great. Well, again, thank you very much for being on the show. I want to thank our listeners for listening. This is Dr. David Scharf. You've been listening to Healthy Living Radio, dedicated to bringing you the latest advances in health and wellness so you can live better, healthier, and longer. We'll be back on next Thursday night. Thanks for listening.
You've been listening to Healthy Living Radio with your host, Dr. David Scharf. Join us next week for another edition of Healthy Living Radio.